Known respiratory diseases like tuberculosis or TB are highly contagious and even deadly. But there are also emerging respiratory diseases like severe acute respiratory syndrome or SARS, avian flu, and smallpox that can appear unexpectedly and can be just as dangerous. When transmission occurs in the healthcare setting, it is usually due to unprotected exposure to infected individuals. This is why it is so important to protect yourself from airborne contaminants by getting back to basics. N95 or higher particulate respirators are the main defense against airborne infections such as TB. If there is a risk of exposure to an infected individual, the Occupational Safety and Health Administration, or OSHA, and the Centers for Disease Control and Prevention, or CDC, require that certified respirators must be worn to protect you from inhaling infectious airborne particles. But respirators can only protect you if they fit correctly and are worn at the appropriate times. For this reason, OSHA requires that your facility provide you with respiratory protection training, including when to use a respirator, mandatory fit testing for proper size, how to don and remove respirators, how to maintain and store them properly, when to dispose of them, and what to do if there are problems with the respirator. When a patient has a probable or confirmed respiratory disease, like TB, they are given a surgical mask to wear and placed in an airborne infection isolation room whenever possible, or a private room with independent air supply and exhaust systems, per facility policy. When caring for these patients, healthcare workers must strictly adhere to airborne precautions, which means wearing an N95 or higher respirator to filter the air before it is inhaled. Alternatively, powered air purifying respirators, or PAPR, can be worn to provide protection. N95 or higher respirators should be worn anytime a worker enters a room with an individual that has been diagnosed or is suspected of having an infectious airborne respiratory disease, and when performing high-risk aerosolizing procedures, such as bronchoscopy or suction procedures on patients with suspected or confirmed respiratory disease. It is important to note that only healthcare workers in the isolation room wear respirators. Patients with respiratory disease should don a surgical mask whenever leaving the isolation room. And once outside of the isolation room, transporters are not required to wear a respirator. Fit testing is the process of finding the respirator that fits you best. First, a medical evaluation will determine if you can use a respirator. If you have a medical condition that interferes with the sealing surface of the facepiece, you will not be able to wear a tight-fitting respirator. Fit testing is required before a respirator can be worn for the first time in a workplace setting, whenever a different respirator is to be used, and at least once a year thereafter per OSHA. If you have physical changes to your face, such as cosmetic surgery, scarring, dental changes, or have an obvious change in body weight, you will need to have an additional fit test, even if you've been using the same respirator, to see if it still fits correctly. And if you have facial hair, such as stubble, beard, mustache, or sideburns that prevent a good seal, you may be asked to change or remove the hair to be able to wear a respirator, or may be offered an alternative. Follow your facility policy. Next, find a respirator that fits properly and comfortably by following these steps. Position the respirator on the nose and make sure the respirator fits on your face and cheeks, fits across the bridge of your nose, and properly covers from the nose to under the chin. There should be room for eye protection and talking comfortably. Good strap tension, but not overly tight. The respirator should not slip when worn, and it should look like it fits properly in front of a mirror. A user seal check ensures there is either negative or positive pressure while wearing the respirator, and should be performed during the fit test, as well as each and every time you wear a respirator to ensure proper protection. To perform a user seal check, cup both hands completely over the respirator. Inhale gently. Hold your breath for 10 seconds and exhale gently into the facepiece, or follow the manufacturer's recommendations for testing the seal. If air leaks around your nose, readjust the nosepiece until you obtain a proper seal. You should be able to feel suction being created as the mask pulls tightly against your face. If air leaks between the face and face seal, reposition the respirator by adjusting the straps. It is vital that you find a respirator that seals properly. A respirator that cannot be seal checked cannot be used. To test the seal on your respirator, your employer will conduct a fit test procedure. For example, one quantitative fit test uses controlled negative pressure and instrumentation to measure how much a respirator seal may leak. Or in a qualitative saccharin solution aerosol fit test, a hood is placed over your head and saccharin is released into the hood. In this test, you're asked to look up and down, side to side, and breathe in and out slowly and deeply. You are also asked to breathe normally, talk out loud for a certain period of time, and smile or frown. Your employer wants to make sure you don't taste the sweet saccharin. If you don't, the respirator fits properly. Regardless of the type of fit test used, if the respirator does not fit correctly, you will be asked to try others on until you find one that does fit. If you have problems breathing, you will be referred to a physician or other healthcare professional for further evaluation. Once you find the proper fitting respirator, be sure you know the make and model you should wear and follow certain precautions to ensure your safety while using it. This includes learning how to properly apply and remove a respirator. When putting on the respirator, pull the top strap over your head, resting it above the ears. Then pull the second strap over your head and rest just below the ears. Adjust the strap tension by pulling the straps evenly on both sides. Once the elastic bands are adjusted, mold the nose area to the shape of your nose by pushing inward while moving your fingertips down both sides of the nosepiece. Be sure to use both hands at the same time, as an improper fit could result in a respirator that is not working at maximum efficiency. Second, make sure the respirator is effective by performing a user seal check each and every time you enter a contaminated area. If you cannot achieve a proper seal, do not enter the area. To remove a respirator and other PPE, you should always follow your facility's protocol. But as a general rule, it is best to work from the most contaminated surface to the least. This means removing your gloves first. Properly dispose of all personal protective equipment before leaving the work area, except for the respirator, as this protects you from airborne particles. When removing, avoid touching the outside of the respirator, as it's considered contaminated. Remove by first grasping the bottom elastic and then the top elastic, and discard the respirator or store as appropriate. Always cleanse your hands with an alcohol-based hand rub or with soap and water immediately after removing your personal protective equipment. You should also know how to maintain and care for the respirator, as well as know when to dispose of it. Respirators should be accessible to the work area and stored where they will not be damaged, contaminated, or exposed to dust, sunlight, extreme temperatures, excess moisture, or chemicals. Always inspect respirators before use to be sure they're clean, sanitary, and in good working condition. Respirators can lose their proper shape, and the straps lose their elasticity over time. Never wear a disposable respirator that is soiled, damaged, or worn out. If the respirator is reusable, be sure to clean and disinfect after each use as allowed by the manufacturer. You should also know what to do if there are problems with the respirator during use. If breathing becomes difficult or uncomfortable while wearing the respirator, report your symptoms to your supervisor. If you feel eye or skin irritation, leave the work area immediately. Wash your face, and if you must return to the work area, replace the respirator. If you feel a leak in the respirator and think you've been exposed, report the exposure immediately according to your facility's policy. If you show respiratory symptoms during or following an airborne infectious event or outbreak, even if you're not aware of exposure, notify your supervisor immediately. Don a surgical mask to contain your respiratory secretions and practice infection control. Respiratory diseases can be dangerous, but your facility, OSHA, and the CDC want you to be safe. Learn how to properly select and use respirators, and be sure to carefully follow recommended infection prevention practices. Protecting yourself from airborne infection isn't difficult if you remember to get back to basics.